House Coronavirus Task Force, and at the President's direction have continued to implement his whole-of-government approach to bring the full resources of the federal government to bear to confront the spread of the coronavirus in the United States. Let me begin, as always, by saying that according to all of the experts gathered here and on our task force, the risk to the American public of contracting the coronavirus remains low. That being said, we're continuing to lean into this effort in full partnership with state and local health authorities around the country to ensure that we do everything to prevent the spread of the disease, to mitigate its expansion, and to provide necessary treatment to Americans that have been impacted. But first, let me turn my attention, before we speak about some of our broader efforts and hear from some members of the task force, to an issue that I know is on the hearts and minds of people across the country. The Grand Princess cruise ship has been moored off the coast of California since Wednesday night. I want to commend the efforts of our Coast Guard that heroically flew coronavirus tests to the ship, and we received those results. Working in close consultation with Governor Gavin Newsom and the state of California, we have developed a process for addressing our findings and resolving the circumstances facing Americans and people from around the world and the crew on the Grand Princess. First, the results. Among those tested, 46 persons were swabbed. 21 of those on the ship tested positive for the coronavirus. 24 tested negative. One test was inconclusive. Again, let me say 21 individuals on the Grand Princess tested positive. Among those were 19 crew members and 2 passengers. And it's important to note.
Sorry, among the positives?
Yes. Among those positive for coronavirus were 19 crew members and 2 passengers. It's important to note that the Grand Princess actually was on its second tour, and we know of coronavirus infections from the first tour as well, with very, very difficult results. In the wake of these findings today, we've been working through the day with Governor Newsom and his administration through their unified command efforts in California, CDC, and HHS. And we have developed a plan which will be implemented this weekend to bring the ship into a non-commercial port. All passengers and crew will be tested for the coronavirus. Those that need to be quarantined will be quarantined. Those that require additional medical attention will receive it. But let me assure the American public, as we did so with Americans returning from China and those returning from the other cruise ship, we are taking all measures necessary to see to the health of the Americans and those involved on the Grand Princess, and just as importantly, to protect the health of the American public and prevent the spread of the disease through communities in this country. We are instituting the strongest testing protocols to ensure that not only those on board receive the treatment that they need, but that the American people can be confident that there will be no erosion in our preventative measures in efforts to keep the coronavirus from spreading throughout our country. I want to express our gratitude to Governor Newsom and the state of California for their full partnership, not just in dealing with the Grand Princess, but throughout the advent of the coronavirus. California has been a strong partner, and as I just told the governor a few moments ago, we will continue to work very closely with his administration, and we will continue to put the health and safety of America first. With that, let me turn my attention to the the issue of testing, which has been much in the news of late. And the President spoke about it just a few moments ago at the CDC. It's very important to note that because of President Trump's decisive leadership, that the risk to the American public of contracting the coronavirus does remain low. But nevertheless, in Washington State, where I visited yesterday with members of our team, and in California, we have seen, as Dr. Fauci often describes, a community transmission. Still less than 200 cases across the country, and the good news is most Americans who've contracted this disease are being treated and recovering, and on the road to recovery. Sadly, we all know of the loss of life, and we grieve that along with their families. But the American people deserve to know that we are ready, and that because of the President's leadership and because of extraordinary efforts by CDC and Health and Human Services and our partners in state labs around the country, we have the testing necessary to be able to provide tests to all the states that have requested it. As I said yesterday, we've been able to provide tests to all the state jurisdictions and labs that have requested it, and I'm pleased to report that all state labs have the test. And now, because of the change that President Trump implemented at the FDA a week ago, now state labs can actually conduct coronavirus tests themselves. Beyond that, between March 2nd and 5th, we distributed more than 900,000 tests across the country, including 200,000 that could allow 75,000 individual patients to be tested. As the Secretary of HHS just described, by tomorrow another 200,000 tests will be shipped, and by the weekend another 1 million tests will be shipped around the country, with the expectation that at the end of next week 4 million tests will be shipped. We've been able to respond to the request of states that have been impacted by the coronavirus. But as I said yesterday, to meet future demand, this week the President brought together the leading commercial labs in America and asked them to, in effect, partner with the United States in developing tests for the American people. And I'm proud to say that just in the last 24 hours, LabCorp, Quest, two of America's leading commercial laboratories, have announced that tests will be available by Monday of this week. The reason that's important, the reason that meets future demand, is because the enormous capacity of these commercial laboratories and others in the country are precisely how we will make coronavirus tests available for your local doctor, available to your pharmacy, and broadly available to the American public. Tomorrow, Dr. Steve Hahn of the FDA will come to this room and brief in specific our efforts